Okay, let's try healthcare. Everybody talks about Obamacare, and yes, I'm against Obamacare. It's a simple, bad plan. You cannot force people to buy something. But everybody talks about, I was on Facebook today, people arguing with me about, oh my God, my cancer was bad, and I'm going to lose everything I had. If I'd had Obamacare, I'd fix it. My God, my brother got hurt, didn't have health care, he lost his house. Well, you got to get in the real world, people. America was founded on what you can do for you, not what everybody else can do for you. If you're working a job, you get out of college in your 20s, or you don't go to college, you get a hard working job that kind of makes you dirty and sweaty, and you work your ass off, and you get married, you buy the 2 cars, you buy the house, you buy the pool, you buy the jacuzzi, you buy the boat, the jet ski. You don't think about health care because you're not sick. So when you get in your 40s or 50s and something goes wrong and you lose everything you got because your health care wasn't there and you can't get it now, it's nobody's fault but your own. We have to start teaching our kids. Set some money aside for health care. Yes, it's expensive, which means maybe you can't drive the Corvette, you got to drive the Cavalier. Or when you get married, maybe you can't have the house, you got to live in an apartment. Teaching you, monitor your money. It's not the government's fault. It's not everyone else's fault. If you got sick and didn't have insurance, it's your fault for not buying it. I'm guilty. During times when I was younger, carry the minimum amount. Personally, I got lucky because at age 43, I just decided to buy the Aflac insurance one day at work. At the cost of $80 a week, I bought Aflac. And 2 weeks later, I fell and shattered an ankle and had to have it replaced. And Aflac gave me over $30,000. So yes, that right there showed me I was doing wrong. You have to invest in it and have health care. And this bit about if you get big health care bills, you'll lose everything you got, that's bullshit. I hate to use that type of language on my videos, but it's a simple fact. You can go $4 million in debt, and if you do it right, you admit to your debts, you answer the calls, you don't just ignore them, you will not lose your home, you will not lose your cars, you will not lose everything you own. Granted, your credit report will be screwed up, you might not be able to buy no more, but you'll keep what you got. It's the way the system works. It's those that don't answer letters, don't get to it, they just ignore it because there's nothing they can do to lose what they got. Now, healthcare itself. Obamacare is not the answer. State-run programs and federal-run programs don't exist. In Canada, a couple years ago, a 6-year-old girl died from a broken arm due to infection and sepsis that set in because she had to wait 2 days to get approval to go to the hospital to have her arm worked on. I know that's worst-case scenario. But if you talk to people in Canada, that's an everyday occurrence after years of federal health care because the money's not there, the programs aren't there, the doctors are leaving because they're not making no money. Everybody brags about how Europe's got health care. Britain's health care system is broke. France's health care system is in the negative and they're looking to change it. Spain almost had theirs changed and the Muslims got into over there and that's just screwed their whole country up. Australia has done totally away with their state-run health care. They realized it was putting them in the hole and they were about to go bankrupt and they done away with it. They're back to our system we have now and they're loving it. And yet Obama wants to take us down that route. Now, you want to answer the problem to lower health care costs? We have regulations now that stop insurance companies from going across state lines. In Indiana, insurance company can't do business here in Ohio. Ohio one can't do one in Kentucky. Let's do away with the interstate laws. Let's let insurance companies do business across state lines. I guarantee your rates would come down. Because you have states that have high cancer rates, the insurances are higher. You have states that have lower cancer rates, so their rates are lower. So let that state with the lower cancer rates sell insurance in another state. Yes, they may have higher premiums in the cancer state, but they can have lower than the insurance companies there because they don't have the risk that insurance company has there of insuring everybody. You got to let insurance companies go across state lines. That's the answer to solving the insurance problem. It will lower rates. And we need a law that simply states, if you do not have insurance from your choice of not buying it, then your medical costs come out of your pocket. And for those people, as I said earlier, yeah, I want them to lose their house and their car and stuff. If you're 20 years old, you and your wife are in your 20s, you're working hard, you have a couple kids, you're making good money, you're going on vacations, you're buying boats, houses, cars, you know, doing all this stuff, and you're not buying insurance, when you hit 30, if something goes wrong, I want you to lose it all. Because you didn't use your common sense and buy insurance. Now, for that person that is working at McDonald's, which McDonald's is trying to get insurance for their people, they got a waiver from Obama. 3,000 waivers given out for Obamacare. And he's given out that many waivers. You really think he thinks it's going to work? It's more of a control. But McDonald's gives out insurance. Do you think people working at McDonald's, at Burger King, at Arby's, at even Walmart can afford insurance? They can afford the bare minimum, which will get them by for a broken arm, broken leg, you know, getting sick, something else like that. But a major catastrophe, they lose everything they got. Now, them people I feel for. If you can't get a job that pays you enough to get insurance, them I feel for. But again, letting insurance companies go across state lines would let them get more insurance. Might not let them get everything that they'd want, but let them get more. The ones I have no remorse for are the stockbrokers, the bankers, the doctors, the lawyers, the computer specialists that don't buy it when they've got all the money in the 80s, 90s, and 2000s, and now that they're getting sick as they're getting older, oh, I need health care from the government because I can't afford the $1,300 a month premiums. Well, you know, if you'd have got insurance when you were 20, when the premium was $30 a month, there would have been gradual increases, and you wouldn't be paying $1,300 a month at 50 now. But you waited till the last minute, and that's your fault, nobody but your fault. Let's quit blaming medical costs on insurance companies, medical costs on doctors. Blame it on yourself for not buying it when you had the chance to get it. I mean, it's just that simple. Thank you.